Right, let's do a bit of housekeeping first of all. Welcome everybody to this joint health, wellbeing overview and scrutiny, and along with Family and Children's Services. Welcome to the press. Let's hope you get everything right. He's laughing. I'd like to welcome Cabinet Member Veronica Jones. I can't see any other Cabinet members here. No. And this year's New Year's resolution is that PowerPoint only lasts 10 minutes. So I hope you've all had a good Christmas. Unfortunately, I've had shingles on the top of my head that's nearly to my eye, so I've got trouble seeing people, so I can't say Councillor Hill or Bowman, so if I ignore you... Yes. So welcome everybody, let's get cracking, because we do have some lengthy, or could be lengthy, items, so apologies for absence.
Chair, I've received none.
None. I don't think we're all here. Any from fax, or do you know?
Yeah, the Anna Watson and Holly Waddell. 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 Posh version. Yes. Waddle.
Right. Minutes from previous meeting on, this is for health and wellbeing overview and scrutiny, pages 1 to 8. I see no one indicating.
Move acceptance, Chair.
We do. We're happy with that. Bit 3, disclosure of members' interests. Anybody? Anything from Berwick? You're all sitting there. Right. See nobody. Item 4, joint report of the Cabinet Member for Inspiring Young people, and the Cabinet Member for Improving Public Health and Wellbeing. Now I've got John Lawler and Graham Wright to take this up. Straight into you, then we can see who wants to speak after that. Right, floor's yours.
Afternoon, everyone. My name's John Lawler. I'm one of the public health consultants, and I'm with Graham Writer.
Good afternoon. I'm the Director for Children's Social Care, Young People and Families.
Bearing in mind the introduction that we had about the 10-minute rule, I'll try and be as brief as possible. This is the third... It was
a joke.
It's the third out of 4 reports which are about updating the Council's Joint Health and Wellbeing Strategy. This is the third report, as I said, and this theme is around giving children and young people the best start in life. There is a detailed report which accompanies the presentation, so I will try and be brief. If I can find the clicker. Okay. Just to open, I mean, this is where this theme sits in the Joint Health and Wellbeing Strategy. It's the first of the 4 themes, and without labouring the point, it does put a clear emphasis on children and young people. It puts them first and forefront in the Joint Health and Wellbeing Strategy, which is absolutely appropriate. We know from the Marmot Review that giving children and young people the best start in life was the highest priority for tackling long-term inequalities and reducing inequalities in health outcomes over the long term. We started to review this theme as part of the overall review of the Joint Health and Wellbeing Strategy. The way that we approached the review was to look at progress against the indicators which are associated with this theme. We also looked at qualitative data from annual reports and from external inspections. The reason why we did that is because the national indicators, which I'll explain, they're helpful, but they do have limitations, and there is a wealth of additional information which is available to us. We also looked at work within partnerships about reviewing priorities for children and young people. This is building on extensive work which was undertaken through the Northumberland Children and Adult Safeguarding Partnership and also the Children and Young People's Strategic Partnership. And we also looked at and considered ongoing work to review and align governance arrangements for services and partnerships. That's really within the children and young people's arena. And it's fair to say that over the last 12 to 24 months, there's been a significant amount of work to look at governance arrangements. I don't know if you wanted to mention something about that, Graham.
Yeah, I think that's crucial for us because across all the partnerships in children's, we're trying to streamline the work, make sure it's focused and not duplicated. And we've used the work that John and myself are leading on here today as part of pulling all of that together. And there's another agenda item later on about the safeguarding priorities, which are also a part of that.
Thank you. So I think in summary, the review includes a lot of partnership opinions as well. It does include the voice of children and young people in that it reflects what has been fed back through the Children and Young People's Partnership and the Children and Adult Safeguarding Partnership. Albeit I think Graham might pick up on that later. Whilst it does include some of the voice of children and young people, probably not as much as we would like to. Moving on to the next slide, this describes the outcome. So the theme has an outcome, which was for all children and young people to be happy, aspirational and socially mobile. And sitting underneath that, there are three priorities described, which is giving children and young people the best quality education, ensuring all children and young people are safe and supported, and then supporting children and young people to make positive lifestyle and social choices. Of the three priorities, I mean, the first one, education, it is a completely fundamental to this theme. Inequalities in educational outcomes follow a similar social gradient to other health inequalities with lifelong impacts on children and young people, both on their physical and mental health, employment, income, and overall quality of life. And we know that actually improving educational outcomes has a significant impact on inequalities. It's one of the most important things that we can do and one of the most impactful actions. We have responsibility, this is all partners around the Health and Wellbeing Board have responsibility to ensure that children are safe and supported, and that includes statutory responsibilities. I don't know if you wanted to pick up anything on that at the moment, Graham.
No, so I think I'll probably cover that more in the later agenda item on safeguarding, again, which will demonstrate again how we're thinking across the range of partnership arrangements that underpin certainly children's services. And the third area was around supporting children and young people to make positive lifestyle and social choices. And this is the priority area that within the review we had the most discussion about and proposed the most changes to. Aligned to these actions, for each of the key actions, there were a number of interventions or actions that it was proposed that we might do in order to fulfill those priorities. So the actions are described for each priority. Some of these, if you've had a chance to look at the report, some of them are very high level and some of them are very specific. And this is one of the key areas that we focused on in the review about actually realigning these priority areas or actions for each of these areas. The most significant one, I think, was probably the third one, supporting positive lifestyle and social choices. This is where we made the most changes or recommended the most changes because, I mean, for us, it didn't explicitly include physical health and well-being, which we thought was actually crucial to explicitly mention that in the updated strategy. As I mentioned, there are national indicators which are aligned to each of those three areas and I have grouped them there according to education, safe and supported, and positive lifestyle and social choices. Perhaps it's easier to read in the report, but probably the far right two columns are the ones that's probably worth paying most attention to. Where it's green, that demonstrates an improvement, and where it's red shows that where we haven't improved or there's been
a worsening in that specific indicator. These were national indicators which are aligned to the joint health and wellbeing theme. There are limitations with these national indicators in that you'll see that the time lag in some of them is significant. So for some of the indicators, particularly around exclusions, the nationally published indicator hadn't been updated since the baseline review. For some of the other indicators, such as smoking at time of delivery and breastfeeding, they're really important indicators, but we did question about whether they would be the most appropriate indicators to indicate positive lifestyle choices by children and young people. As I said, there is something about timeliness of the national indicators, but the other thing about the national indicators is that published at a county-wide level. So what that doesn't show us is variation within county. And we know from other measures that there is variation or inequality across Northumberland. We also looked at, as I said, these narrative and qualitative indicators. This included outcomes from external inspections and statutory inspections. There's a wealth of information which we have as a council, and I think there's some really positive news and some really good news stories in here. For example, in education, there's excellent early years provision, excellent uptake of statutory entitlement to early years provision, and in 2022, the highest Ofsted outcomes for schools in Northumberland. I don't know if you wanted to pick up some of the other ones around lifestyle choices.
The other element for us, that, as John is saying, is that we're really wanting to look at the qualitative indicators information that we've got, as just the performance data really is just a starter for 10, and actually understanding the quality and the impact of what we're doing needs a range of ways in which we look at that. And again, talking a future later agenda item about some of the qualitative analysis of the work that we're doing, and as well as what we will look at internally is the external inspection from Ofsted, particularly in terms of what they find and the narrative findings, some of which we've summarised here. But the importance for us is that understanding the so what question, the impact and the quality of what is being offered and how that affects children and young people.
Sorry, jump forward there. I think this was a review of the first 5 years of the Joint Health and Wellbeing Strategy, and it would be remiss of us not to have noted the impact of COVID, which was very significant for 2 of those years. As we know, COVID disrupted face-to-face education. It's had an impact on children and young people's mental health and well-being, and potentially impacts on safeguarding, school readiness, and we know from a number of reports that it's had a disproportionate impact on certain children and young people. Not all children and young people, but actually those most disadvantaged have borne the brunt of the COVID impact, and that has, without a doubt, had some impact on progress for children and young people in Northumberland. And the next 5 years of the strategy, I think, will have to almost be some COVID recovery as well. Certainly that's taking place at the moment. The proposals in terms of refreshing the themes, for the whole theme, we propose to rename it to Starting and Growing Up Well. The rationale for that is that the best start in life has some very specific connotations. It's often used to refer to the first 1,001 days or the first 5 years of life by other people. Those early years are absolutely critical. We're not kind of denying that and wouldn't want to downplay that. But within this theme, it's about children and young people across the whole of that age spectrum, so through into childhood, adolescence and preparation for adulthood. In terms of the priorities, we decided to retain education and growing up well as an absolute priority, and the same as children being safe and supported.
but we did add in the most changes to children's physical and emotional health and mental health and well-being. So that was going to, or we've proposed that as the third priority area, which replaces that area of making positive lifestyle and social choices. The rationale for doing that is that it includes an importance or places importance on physical health and well-being. We've got some key partners who sit around the Health and Wellbeing Board, so particularly Northumbria Healthcare Trust and Harrogate and District Foundation Trust, who provide our 0 to 19 service, both of whom are crucial partners. It emphasises the holistic approach and contribution of all of those partners, and it also provides an opportunity to include some other elements, so particularly things like Core 20+5, which is an NHS approach to tackling inequalities. So as I said, in terms of the education theme, we propose to keep that the same. There are some proposed actions there, which in summary are around challenging and supporting improvement in schools and educational settings. It's an emphasis on education in its broadest sense, so it includes not just academic attainment, but also vocational training, and emphasises the importance of partnerships. In terms of safe and supported, did you want to mention that, Graham?
Yeah, I think so. And I think the kind of areas that we're covering there are detailed in the report, ensuring children are safe and supported from early support, universal support and intervention to the more statutory, heavier end interventions that are required to make sure that we keep them safe. And John will talk a bit about, well, not only is that the safeguarding partnership responsibility, we are looking at making sure that the Children and People Strategic Partnership focuses on that earlier intervention, safe and support. And whilst the safeguarding partnership, which I'll talk about later, is going to concentrate on the heavier end of protection, and that's how we're organising those range of services, but equally making sure that key and central to that is tackling any form of disadvantage that our children, young people and families are facing, how best we mitigate, support them in relation to that. And one of the key areas that, as we looked across the range of work, one of the key areas is workforce, the challenges of maintaining and having a sufficient and sufficiently skilled workforce to be able to deliver all the services that we needed. So we have put an emphasis there on workforce recruitment, retention and development as well to deliver what we're talking about and proposing here.
And finally, for the priority areas, as I said, the updated priority area of physical and emotional health and well-being. As I said, the rationale, I've explained the rationale for that already. And as Graham has highlighted, it's really about partnership working. So there are some really significant and well-established partnerships in Northumberland. It's about delivering the Healthy Child Programme, which is the national prevention and early intervention programme for children and young people, and that's delivered in partnership both through our 0 to 19 service and through the extensive family hubs offer which we've got in Northumberland. And significantly, I think in this priority area we've included promoting healthy weight and physical activity, so making some references to some specific key areas of public health for children and young people in Northumberland.
Okay.
And finally, yes, to the discussion points. There was a significant discussion at the Health and Wellbeing Board, which accepted the proposals. The Health and Wellbeing Board accepted the change to this theme in terms of the title and the amendments to the proposed priority areas. So I'll close there and happy to take any questions.
Right. Anybody? Councillor here, I can just see.
Thank you, Chair. Just a couple of comments and a question. It does seem typically of this report, to some extent, chasing things that are easily measurable and easily achievable, you know, so things like breastfeeding, and put some leaflets out, get a rise of that, put it in next year's report. And I appreciate this is from the facts and health angle, but looking at the report, it's about giving children, young people, the best start in life and tackling inequalities. Surely when we're having this conversation, housing has to come up, because it's absolutely critical to the start that children, young people have, the financial situation in the family, and the amount of families that I know who they're stifled because they're living in such cramped conditions. They can hardly breathe. They can't develop by having their own space. I know, and I'll give you one example. I can give you hundreds. You know, somebody that, the daughter's studying for GCSEs and having to study in the cupboard, cramped where the Hoover and the washing machine is, because there isn't any space. So surely, I know that's a huge area, and there's huge national policies and so on, but that huge inequalities with housing. But I don't think we can talk about inequalities and giving children, young people, the best start in life without talking about the housing crisis.
Do you want to comment on that?
I will comment on it because I think that is probably covered in the next presentation, which is the final theme of the Joint Health and Wellbeing Strategy, which will include wider determinants and housing. So that question might be answered by that presentation, or you might want to ask it again afterwards.
Okay, you did vote for houses the other day, so that's a rarity. Anyway, Councillor Hunt.
Thank you, Chair. Inequalities comes across in different formats, and I know it's going to take years and years to get past this COVID situation. With, rural ones has a different inequality to urban ones. But again, up in the north area, you're coming across schools where the first schools are saying even when they come into nursery, they're well behind. They haven't had the interaction. And the primary schools are having to use their budgets to put in funding health services so that to interact in the schools, because as they say, until they unravel the health problems and the mental health problems, they can't get on with the education. And some of them, one of the areas that I represent, is quite deprived. So therefore it's a case of they've already been on the back foot before COVID. And I think it's going to take us years to do it, and how we can get that inequality sorted out to give them as good a chance as everybody else. But again, it's how we can get around that, and it's going to take years to come across.
Councillor Ball.
Thank you, Chair. So thank you for the report. I'm not really seeing anything radical changing from what it was to what it is now, which concerns me because we're seeing child poverty rates go through the roof. Kids are where they're living, the houses, they can't study because the houses are cold, they're not getting good quality food. School budgets are being cut, so in some cases the nutritional value of school meals is not what it should be. People aren't entitled to free school meals even though they are living in horrific circumstances on baseline income. So I'm just wondering, is this radical enough to be able to tackle some of these problems that the young people are facing? Because we're seeing horrific, when they start using words like destitute for young people in the UK, I think it's absolutely terrible. So I just think, is there a way that we can really do something a bit more radical? Because as I say, it hasn't really changed from what was to what it is. And I think the state of play, and especially when we don't really have much in the way of influence, it mentions partnerships, but actually what power and clout do we have to make and enforce that the academies get on board? Because there's a number of things, whether it be school uniforms and stuff like that, that we have no influence at all, and it does all have that impact on young people in school, because if you can't buy the rugby kit because it's too expensive, then you're never going to be able to take part in the activities. If you can't go on the school trip, and I just think all these things have a massive impact on, we say that we want people to be able to be ambitious, and if you can't do the simple things within your school, you get bullied, you're excluded, you don't get them life opportunities, then you're never going to blossom to your full potential. Thank you.
Okay, I think that will be one of the cross-cutting themes, and the approach that we're taking, as I say, there will be different partnerships looking and focusing on different areas, but there'll be certain cross-cutting themes, inequalities and poverty will be one of those. But at the last Health and Wellbeing Board, Emma Richardson gave a presentation around the poverty and hardship work, but with a very specific focus on children and families. And one of the developments of reviewing the strategy here is that that is now a very specific focus around the impact on children and families, and that will be monitored, reviewed and looked at through the Children and Young People Strategic Partnership much more overtly than it has been. So I think it is more integrated and upfront. But you're right, that will cross-cut the range of partnerships, whether it's school achievement, attainment, whether it's about young people being able to get to school. And I know we will be looking at those in more depth and detail within the Children's Family and Overview Scrutiny Committee. But I think it is more overt and upfront in this iteration going forward.
Mr Hodgson?
So we're going to have more than just themes, we're going to have a plan. Because at the minute I just feel like we've got the themes, but there's not a radical approach to be able to really make a massive difference.
Can we pass a mic back? One of the spares or whatever. No, I can switch them off from here, Caroline.
Right, thanks. Yeah, you referred to school readiness as a negative impact of COVID. Could you just put some flesh on that and explain exactly what you mean by school readiness or the children not being school ready? What sort of research has gone into it? Have you got any figures? In other words, how serious an issue is this? Because from previous studies, we're aware that children who are not school ready, that gap invariably isn't closed. This is pre-COVID. So are we talking about a significant increase in the numbers? And if so, what resources are we being directed to this? Because this is actually critical, because those 4+ children will struggle throughout primary and by definition, therefore, never make the gap up. So how big a problem is it for us in Northumberland? And have you got the numbers? And is it very much an area issue? And therefore, can we be more specific in directing resources to improve this particular cause for concern?
My answer is going to be a broader one in the first instance, because I'll just go back to the approach we're taking about how we're going to work and move forward on all the elements of the health and wellbeing strategy, and actually want to maximise and use the existing partnerships and work that are in place. So I think for a more detailed understanding and dive into the education elements or school readiness, my suggestion would be that would be picked up through the Child and Families Overview and Scrutiny Committee when we look at that specific area of work. What we're trying to do here for the health and wellbeing strategy is give a broad overview on the range of areas that we'll be covering, the detail of the work, the analysis and the developments around the key ranges within that will be undertaken by the specific partnerships or priorities of those for those areas that we'll be looking at them.
That's fine, Graham. But if we're going to use a term like that in a report, school readiness, surely we need to know what that actually means.
School readiness, it is a national indicator. I'm always wondering whether I can default to it.
Can you put your mic on? Put your mic on.
Oh, sorry. I think we've got the expert in the room, who's Audrey at the back, who would perhaps be able to comment better on the specific of school readiness and what's encompassed within that measure.
Thank you, Chair. Thank you for the question, really good question. I'll just remind everybody that in the annual education report, we had a big section around school readiness, and in particular, the levels of development that were reported. The gaps did widen that year after COVID, so we are very aware of the gap, and we're constantly monitoring the gap that there has been in Northumberland. The year after COVID, it was a really difficult one to be able to compare with the previous year and the previous pre-COVID. But we did measure it, we did take those statistics, and we saw a dive down. But we did start to see a recovery back in 2023, which was reported in the annual ED report. And you'll see the numbers and the values. You'll also see that by the different areas of Northumberland. But I would expect us to be able to give you that full broad detail within the Family and Children's Services Scrutiny Committee.
Okay.
All right.
Right. Anybody else? Councillor Bowman. I've got you both.
Thank you, Chair. There is a word missing in this report. It has been talked about. You've alluded to it in the next report. And the word is poverty. It would have been good to see that poverty was one of the priorities, to combat poverty, to mitigate some of the circumstances of poverty. It is not in this report. There's a lot of young people who are brought up in poverty, suffering on a daily basis, and probably can't even start school or early years because of their situation of lack of funds to do so. It does affect not just their mental, but their physical. And I think it's just my personal opinion, but I think there's also medical records and reports saying that poverty does have a big impact on young persons' lives, and it's not in here. I would have liked to seen a chapter just on poverty alone and how...
Can I ask then on that point that we get a response for you now and find out where that will be, because I understand you bring this up all the time, and I just want to try and ask now what you're asking. Anybody?
Yeah, I'll just refer back to my earlier point about the work around poverty and hardship generally, and what is developed and is now in place is a very specific focus in terms of that overall action plan and strategy in relation to poverty and hardship, in terms of what that means for children, young people and families, and how we can best mitigate that and support that in Northumberland. I think I'm happy to take the point about having poverty more overtly noted in the strategy, absolutely. But I just think for reassurance in terms of having reviewed it, one of the developments is a much more specific focus on poverty and disadvantage and the impact of the cost of living and other things around, and how that is being responded to for children, young people and families. And there's a separate report, as I say, that went to the Health and Wellbeing Board a couple of weeks ago, which focused very specifically on that area for children, young people and families.
Okay. Yes, go on.
Yeah, what I'm asking for is that to be in this report. Yeah, that's all I'm asking for. There should have been some recognition of poverty in this report, because it does affect physical and mental and education. Thank you.
Right, Councillor Suzanne Fairless-Aiken.
Thank you. Thanks for the report. I was very excited about reading this report, actually, having two children that have gone through COVID and seeing what a mess it is, the aftermath, physically, mentally. It's horrific. So I was truly excited to get this report. My first question is really just about the national indicators, first of all. It's quite simple. The absence, I find them kind of woefully inadequate, which isn't your fault, obviously, they're national indicators, and I wouldn't set much store by Ofsted anyway. But the absence rates, is there a distinction between authorised absences and unauthorised and unexplained absences? Because I think that would be a bit more helpful in those indicators with finding those missing children, or those children that are really missing out, and finding the reasons why those children are missing out, as opposed to the unauthorised and authorised ones that are here and there, and teachers trust the children and their parents and know why they're off and it's all right in a way, as opposed to the ones that are unexplained. And I think that's a huge distinction to me, and I would like to know more about if that is something that you would focus on. The second one is that I read the report and I got to the end of it and it said finance and value for money. It's not anticipated there being any direct implications. Human resources, no new recruitment is identified. And I'd like to see more mental health counsellors in schools, nurses in every high school. I think this is the response that we need to COVID. There doesn't seem to be any money or any more human resources coming from this report. And it leaves me kind of feeling strangely hollow. I'd like to see a focus on enrichment. I'd like to see a focus on PE, cookery, all of these things that these kids need, drama to reconnect with each other again. And I'm not seeing any of it in here. So I did see something on what was it? Sorry. The BU mental health support teams established in Blythe, Hexham, Ashington, Bedlington. I'd like to know more about where are they, how they are accessed. Are they bookable? Are they through schools as well? Are kids easily able to access this support?
Right.
Sorry, that was a bit rambling. There's two questions, one about absence and one about resources.
Well, I think I will go back to my original point about that this is a very high-level, overarching overview of the health and wellbeing strategy, which is a partnership strategy. Now, the resourcing and the specifics within that, I think it should have more detailed scrutiny. So, for example, I know we're talking about having both looking at attendance and exclusions in schools, and I think the much more detailed, granular analysis that we absolutely need to do needs to be undertaken with it as sub-themes of this. This is just the overarching strategy, and absolutely to take the points that you're making, but I think that really would be sitting in the Family and Children Overview and Scrutiny Committee looking at that specific area of work. And I make the point again, this is an overarching strategy. The approach we have taken here is to try and coordinate it, the whole range of work that is covering children's services, the whole range of partnerships that there are with all the statutory functions and underpinnings that has, to try and bring those together, to try and give them a coordinated view and overview. But sitting within that, absolutely, we need more detailed scrutiny and challenge on the very specific areas that constitute that overall picture.
Right, I've got Councillor Swinburne.
So, Chair, can I just come in before we bring Councillor Swinburne on the point about the attendance, which you've referenced there. We have, through scrutiny, I think you might have missed the last meeting, but we've agreed a refresh of the task and finish work around attendance and the reasons why that there are some issues around attendance in some parts of the county. So that's a piece of work which I've asked today to be fast-tracked, because I think it's really important. And the other thing to add to that point as well, you mentioned at the beginning of what you said about how the coding system in schools for non-attendance is done. The Parliamentary Select Committee, Education Select Committee, in October recommended that local authorities include a new coding of mental health absence. Now, that's a question I think we can take outside of this, but that was agreed as the Select Committee's recommendations to local authorities to pick that up, because that falls back into the wider context about why is it some kids are not attending, and looking at that to drill that data down to then look at how we can seek to support those young people. But sorry, I just wanted to chip on that because I thought it was relevant, Chair.
I think we've seen it nationally. It's not just here. I'll go to Councillor Swinburne.
Thank you, Chair. Thank you, Councillor Daly, for just pinching some of the stuff I was going to mention there. But I want to pick up on something that Mr. Hodgson said on the comments that he made. And it's about the pandemic, which comes up regularly, and everything that's happened there. And while I don't want to specifically attach education with businesses, just want to go back a bit, that many of the more successful businesses, and even this council as well, not only adapted through the pandemic, but they evolved and made many, many changes to become more successful afterwards. Those that didn't make changes and just thought afterwards, we'll just go back to what we were doing before, were less successful after the pandemic, not as successful as the people who realised that there was more that they could do, and made those changes and progressed afterwards. And I appreciate that this is more for facts. But what I would be interested in, and I'm going to ask for this if we can bring this to facts, is finding out what happened in the education sector, in schools, in primary schools, in the higher schools, and so on. What happened there? What adaptations and what did they progress with? Or did they just go back to what they were doing before? And that includes the 2 task and finish groups. Did they just go back to what they were doing before with regards to absences and exclusions? Or did they adapt and think we need to do things different? Bearing in mind that there's legislation that they need to follow. And I'd be interested in some of this information coming to facts. I appreciate, where we are in this setting today, which is why I say it is more of a facts question. But that's what I'm going to ask if that's possible.
I'm going to ask Councillor Daly to respond again. Do you want to just, because that's pointed at you, I think.
Yeah, I think we'll pick this up outside of this meeting. I mean, I know certainly that schools, one of the things that did develop was hybrid learning, which obviously they had to do, but I think we can pick this up outside of the meeting. Because clearly things are improving in some areas and some areas not. And we need to look into that. So the valid point, we'll pick this up afterwards.
Right, you also indicated you want to speak, or was that?
No, I do.
Yeah,
So there's a couple of things. One is, and it was Councillor Ball who mentioned that it wasn't very radical, but I think Graham Wright has really pointed out that this is a high-level stuff. So I think what's really exciting and could be potentially radical is the granular detail which sits under each of these elements. And this is for us as elected members to help shape and frame that with officers and with schools. But one thing which is in the report mentions school readiness. I have a bee in my bonnet about this because it works both ways. It's both the child being ready for school, but the school being ready for the child. But there's a third one, and that is parental readiness. And that's something which isn't, whilst it's not encapsulated necessarily within this report, it does reference around supporting young people, supporting them to get the best start in life, etc. And one of the things that we can do, we have a partnership on our 0 to 19 service through Harrogate, and along with health service partners within maternity and early and pre-birth sessions, is I think we really do need to focus around parental readiness. There's a big report today about school absences come out. The Social Justice Foundation did a piece of work which showed around 23% of parents don't think that school's relevant. They don't think they don't need to send their children to school. And that's worrying, because if nothing else, school provides you with the ability to be socially inclusive and to mix with other people of different ages and socioeconomic groups and whatever. It's society. Right. And I think there's something that we can do, particularly with our 0 to 19 providers, to look at parental readiness. And that's something I'd like to see radical come out of this, which is to see that we make sure that everybody plays their part in making sure that everybody gets the most that they can get out of their school time. But that's the only point that I want to make, Chair.
Right, I'm aware of time that we're rattling on a bit. Councillor Scott and then Councillor Chicken.
So it's just a quick question. I just wondered if this council devised a COVID recovery plan for children and young people, or was it the national COVID recovery plan?
Yeah, I'm looking at this. I think I'm just trying to work out the kind of things that we did do that would be very relevant for us locally. And I'm just looking across at Audrey more just for confirmation of that it absolutely would have done something specific on the range of ways in which we
Deputy Leader at the time, Cabinet Member, and we categorically did put in our own version of a COVID recovery plan, including detailed work with head teachers, support staff, to ensure that children were supported during that period when schools were closed.
So did that follow on to now, though? What's the plan now? So we're the kids are really struggling.
And I think this is what this is about now. It's about looking at how we take things on from that period when schools have gradually reintegrated young people back in, and teaching and learning has continued, and we've seen issues around absences. So this is what this is very much about. Don't know if Audrey wants to add anything to that, but categorically I can tell you we did masses amount of work, far more than I think many other local authorities did in supporting our teaching staff.
Right, I've seen the microphone move forward and now move back. Audrey?
I think, first of all, Chair, if it's okay if I could say something, and then I think Jill, with her inequalities hat on, definitely wants to pick up. But yes, just to provide members with assurance. So there was a comprehensive plan throughout and post-COVID, and we spent a lot of time. In fact, we're coming to the end of some posts that were specifically put together around helping that transition back into the business as a new business as usual, not the previous business as usual, and that was really important. We've moved on again because actually you're right in pointing out that the challenges that schools face are the same as we face as a local authority with residents. They're evolving and changing, and some of those emerge from time to time. They're changing all of the time. For our young children who were born during COVID, it's a very different experience going into school. For teenagers who were ready to go through public examinations, it was a really challenging time for those moving on to university. And for children who had learning difficulties and disabilities, that was a really, really strong, challenging time. So we're constantly working with partners, with schools and with our health partners around how we can do things differently. And that looks different in different schools and different settings according to the needs of their particular cohort. So that is it's what we do, I'm going to say, on a daily basis. You know, if I think about the integrated work with children's social care, the integrated work with public health colleagues, and you're right, as Councillor Daly pointed out, the integrated work with our 0 to 19 service. They have been very direct conversations around how we keep children at the heart of our decisions, making sure that they're supported. That's not taking the challenges away, and it's not making the challenges even less. But it is addressing some of those challenges, and I'm sure we'll be doing that for some while to come.
Good afternoon, everyone. A couple of points, really, just to reiterate some things that have already been said. For context, I think it's perhaps some good learning for us that we've brought these themes in individually, and that's created some questions that actually it belongs in this part of the report or it belongs in that part of the report. So no doubt when Liz and Rob speak, you'll be thinking, well, where's the education section and wider determinants? It's because it's in the children's section. So when it all gets knitted together, which is the intention, and it'll come to Health and Wellbeing Board in March, you'll see the refreshed front-end introduction making reference to why we've done this refresh, and we've done it because the world is in a different place because of COVID and because of the cost of living. So you'll see up front that reference to poverty in the introduction and that scene setting of the all four themes, and why when you read them in totality, I hope it will make sense for you. The other points that I just wanted to make were, you're all hopefully very familiar with our inequalities plan and the recent policy conference that we held when Graham's making reference to the poverty and hardship plan that sits inside that inequalities plan, again, which was written because of where we were at to make sure that is implicit but now becomes explicit within the refreshed joint health and wellbeing strategy. And my final point to make in relation to how radical we're being, the evidence base is the evidence base, and actually when the Health and Wellbeing Board report was written 5 years ago, it was still the evidence base as it is now, but we've tried to look at that with fresh lens of context and to see what is different that we could go further with. And the actions are more explicit than when it was written 5 years ago, so that is a positive. But actually, as you know, we're then transcending towards our county partnership mission as well. And we are contracting with the Institute of Health Equity and Professor Sir Michael Marmot to make sure that all of the work we're doing does undertake deep dives, so one of which would be Best Start in Life over the next couple of years, for us to do diagnostics on ourselves to say, are we doing as much as we possibly can from that policy perspective? And as Councillor Daly says, that challenge from elected members and from scrutiny to go, what more can we do as officers within the context of what we can influence in Northumberland? So I suppose it's just seeing the joint health and wellbeing strategy in the context of the inequalities plan and our future transformation towards that county partnership mission, just to try and knit it all together for everyone.
Right, we're getting near the end. I've got 3 more people who haven't spoken. I'm going to go to Councillor Chicken.
Thank you. Sorry if you can't hear me very well. I'm recovering from a cold. I wanted to say something off the back of what Councillor Daly said about parental readiness. I think one thing that I hear very little of, unfortunately, is parental responsibility. We've got children going to school who are still in nappies because parents haven't taught them how to use a toilet. The parents don't think that's a necessity. They think that's something that the nursery staff or that the school staff, even children who are in years 1 and 2, still having to use nappies, children who can't speak properly, not having their incorrect speech corrected, speech impediments not dealt with. We need to get much stronger links with our primary schools and our social services and the family hubs. The family hubs provide such a wide, broad spectrum plan for the entire family, and as it has been mentioned, by the time the child gets to school, if they are so delayed at that point of 3 and 4 years old when they're in nursery or in school, they've got such a lot of catching up to do. The rest of their education is affected. We need to be stressing upon parents what their responsibilities are and making sure that they've done their part by the time they actually get to school, so that those children have got the best start in life. And I think the best way around doing that is with those links of social services.
I've got Audrey wants to come in on that.
Thank you, Chair. Thank you, Councillor Chicken, because actually what you've allowed us to do just to end this is to just show how we've adapted all of our services to be integrated and working together to absolutely support families. So there's no point in having a family and a service and then another contact with the service. So actually the development, and I'm hoping by the time we get this whole strategy refresh, you will see that that's the theme throughout. So we're bringing together all of the partners, we're linking all of our services, and where perhaps previously you had 2 conversations, it's a single conversation now. It will take us time, but this is something that we were well aware of, and the teams have really focused. So, for example, if I think about John and the work he's done with 0 to 19, John spends as much time with the Children's Services team as he does with Communities First and Public Health, and Graham with partnerships more broadly. So the work with family hubs is so key to this change around parental change and support that we can help with. So thank you for that, because it's allowed just to hopefully lead into the next pieces
Right,
for colleagues.
I've got 2 more, Derry Nugent and then Councillor Seymour.
Thank you very much, I appreciate it. Just to make people aware, if they're not already, we at Healthwatch are doing a piece of work at the moment with parents and looking at the health visiting service, the 0 to 19 service, but specifically about those very early years. So that's going quite well. We get some interesting feedback. So what I would suggest that if members could encourage people to engage with that, just look on the Healthwatch website or get in contact with us and we can set that up. We're doing various focus groups as well as there's an online survey. But again, I think it goes exactly to what Councillor Daly and Councillor Chicken have just said about the support that parents are getting in those very early years that then lead up. So we should hopefully have that report ready for the spring. So do encourage people to engage. Thanks very much.
Okay, Councillor Seymour.
Yes, thank you, Chair. Yeah, very good report. Thank you for the mid-term report. When will the next one be? Do you know?
The final report, this joint health and wellbeing strategy runs to 2028, doesn't it? So it'll be in 4 years' time. There'll be, I would imagine, a final review or a refresh of the whole strategy then.
So there's nothing before then? Just, no.
Okay.
But anyway, I just had a couple of comments, really. You know, we have been going through a rough time with COVID, the whole world, if you like. But through it all, in Northumberland, we've had some excellent Ofsted results, outstanding. So how is that we've done so well when we've had all these challenges through, you know, everything that's been mentioned? So I just wondered if you could comment on that.
I think it's the quality and the commitment of the staff and the workforce would be a critical element for me. to be honest. I think despite the challenges there are and despite pressures that there are nationally around whether it's workforce or particular areas of challenge, that actually the commitment and passion of the workforce actually have helped to deliver positive results for children, young people and families despite the range of challenges. And I think one of the principles that we work on is about continuous improvement, and certainly should not, absolutely not settle on our laurels for all the range of issues that have been raised and the challenges that there are. But I do think despite that, there is evidence of very good, passionate, committed and effective work in Northumberland.
And on that
Good to hear.
positive
So, thank you.
step, we will close this item. It is a joint scrutiny meeting, so we have to give extra time because we've got more people want to speak. So thank you very much. We've given that a good air, and we'll see you in 4 years' time or whatever. Right, item number 5, report of the Cabinet Member for Improving Public Health and Wellbeing. I have got down here Rob Murphin and Liz Robinson. And if you missed the New Year resolution, 10 minutes for... Right, who's kicking off?
I'll do the introduction.
Put your mic on, please, yeah.
I'll do the introduction first, okay. What we're looking at now is going to be a really major work stream and priority during 2024 and thereafter. What this is about, it's still about people fundamentally, but this is looking at the causes of inequality and health inequality that are to do with places. So we're talking about the physical design of places, how they work, and particularly with a focus on housing and the importance of that for any number of reasons. The reason why this paper and presentation was done just before Christmas was that we used to use the term the wider determinants of health. And that explains what we're talking about. In other words, we're talking about like, the non-medical implications on health. But it's been felt that the use of the phrase wider determinants of health doesn't really resonate with the public, and it couldn't mean anything to anyone. So this is a slight bit of a rebranding exercise. In the same way, it's a new focus, and you'll see several areas of work coming out of this. So I'll hand over to this point.
Thanks, Rob. Okay, so just a brief reminder of the priorities we have had up to date in the Joint Health and Wellbeing Strategy. This was consulted with extensively with the support of Health Watch back in 2018, so we didn't want to completely throw out all those priorities that the public had identified, but we really wanted to refine them for the current context that we're in. So that's a reminder. We had some priorities around, particularly around housing, but particularly a focus on fuel poverty and helping people live independently for as long as possible in their own homes. We also had a priority around work, particularly focusing on people with long-term health conditions, keeping them into work, progressing and sustaining work, and also a transport priority, which is of course of vital importance to Northumberland. So just a reminder of the governance around this theme. Councillor Jones is the member lead for this theme, but it actually cuts across, I think last count, 6 cabinet portfolios. So it's been, and quite a number of different departments, so it's been a challenging bit of life's work to get to this point, to give you this update. It's going to be owned from now on by the Council's Place and Regeneration Directorate Management team. So that brings together the Executive Director of Regen and Place, Housing and Planning, Environment, Transport. So it's kind of the right leaders are in that room to sort of own this theme of the Joint Health and Wellbeing Strategy. And Rob, you're in case you didn't know, you're the director sponsor.
So we've talked a lot about this today. So, you know, I'll assume you've read the report, the impact of COVID and also the cost of living crisis that hasn't followed, you know, immediately because of COVID, but has followed because of like global events. We've really seen households really impacted, those most on the lowest income, because their high proportion of their income is on housing costs, food, fuel. So the impact's been felt even greater. Although we've seen sort of weak improvement in employment rates, we're seeing a real stubborn sort of increase of economic inactivity, and this is a real concern nationally, which we've seen that go up by 500,000 since COVID for a variety of reasons, not just long COVID, but a variety of other reasons. And that's the case in Northumberland. We've traditionally had about 40,000 people who are economically inactive in Northumberland, and it's sort of now creeping up to 50,000 since COVID. And that's a combination of people who want to retire, who've you know, done that out of choice, some who've had to retire early due to poor health, and a lot of people of working age who have poor health, as well as carers who find it difficult to work due to their caring responsibilities. Some of the indicators that are in the report sometimes place Northumberland as looking quite average, but I tried to dig a bit deeper into the fuel poverty indicator in the report, which shows that whilst Northumberland looks average, it really masks the inequalities, and that within Northumberland we have rural homes, people, single parent households, lone parents, private rented sector. These are people who have much higher levels of fuel poverty. So it's just to have a caveat on the data. So this is what we said we would do around those first two housing priorities. And the appendix that attached to this report has a really long list of what we've done as a partnership and partners together, right the way across institutions and the voluntary and community sector, using a range of different interventions. The main one's been around linking up better people who need support to advice, debt advice, money advice, fuel poverty advice, better to the people who need it, better to the advice that's available. So that's making professionals more aware of what support's out there. And in terms of the indicators, we've seen some improvement around housing for people with severe mental health and people with learning disabilities, but as I mentioned, probably a worsening around fuel poverty and winter mortality. As John mentioned in his presentation, we have seen the data. There is a lag on it, so we haven't got the latest fuel poverty data. The way the data is collected has been affected by COVID. A lot of surveys have moved online, so we're surveying people with mental health issues that used to be done face-to-face, so you're not getting a really as good a picture as we used to. So it's just to have, I think we're going to need to wait longer to see what the trends are around some of these areas. So the second sort of priority area was around helping people with long-term conditions move into work and progress. And there's a range of partnership initiatives, some funded nationally, some funded through the Combined Authority, and also some really good examples of schemes that try and improve the quality of work through voluntary accreditation schemes and employer support. So we do actually see the national indicator showing there could be a reduction in that sick versus non-sick people in employment, that rate reducing, and employment rate reducing as well. And the final priority was around transport. We said we would introduce passenger services to the Northumberland line, which is ongoing and getting nearer to completion. We'd also improve the number of children and young people and adults walking and cycling. And we've seen that we have seen a shift in cycling. It appears to have increased the rates, but walking seems to have had the opposite impact, seems to have reduced. But I think there's probably some caveats worth mentioning there around the data, that the surveys haven't been quite as robust as pre-COVID. So these are some of what we're proposing to change, as Rob mentioned before, to change the theme of the name of the theme to Building Blocks for Good Life. There's been quite a lot of research around what creates good health, and the public generally think it's personal responsibility, or how much healthy food you eat, or how much exercise you get, or how good your GP is or your hospital, but they don't understand or appreciate the role of these wider things that we've been talking about today, that it's the good quality of the home you live in, is having enough money to live on. So they tested different ways of getting this over to people, and building blocks, building a healthy society seemed to really resonate well. So we'd like to adopt that, and the Health and Wellbeing Board agreed to do that as well. The housing priority would like to broaden it so that it's more about the role of the planning and regulation in housing, and not only fuel poverty. And also we wanted to keep the economy theme similar, that it is focusing on employment gaps for people with long-term physical and mental health conditions. So that's kind of, but looking across the whole life course, people with disabilities as well, and the transport theme to remain the same. So we refreshed all the actions. So these are how the priorities are shaping up now. We have 4 priorities around healthy housing and planning. A lot been happening with our planning colleagues about really embedding healthy planning checklists and health impact assessment processes in the planning process, where developers have to think about health more explicitly than they've ever had to before. And we want to do much more work with developers earlier in the process than waiting until applications come in. There's 2 priorities there around housing in our more urban areas in Blythe and the Hurst, and also a priority around affordable rural housing and improving the quality of housing, particularly using our influence as a landlord to be a real exemplar to other social landlords in the private sector, because that's where the standards aren't as good. Inclusive economy is the second priority area. So this is, again, focusing on support for those people who are out of work but also have health conditions. Can we be better working together across employment and health services? Can we try new approaches where people are looked at more holistically around what they're passionate about and what they're interested in doing as a way to motivate people to try work again? Increasing the quality of work, so we do a lot around, as you know, around regeneration in our via Borderlands and other regeneration schemes to try and attract good quality work into Northumberland, but also working with our existing employers through a variety of different voluntary accreditation schemes. And then also, could we use more the role of our anchor institutions? Northumbria Healthcare is a really good example of the work it's done with the Community Promise, and could we really bring other institutions into using this framework around social value, and also the private sector? And also opportunities around impactful volunteering, which can really be a good stepping stone. So there's quite a lot of initiatives ongoing around volunteering. There we go. And the final priority, really we're not going to change much of that, but really hone in a bit more on the actions. This was probably the most least developed of the themes that we had. So there's lots of opportunities coming around devolution with the mayoral combined authority, and we're already seeing improvements from the bus service improvement plan. We're seeing routes being developed in Northumberland, particularly around rurality, which is we're having much more power at a local level and funding. There's much more we could be doing around. We do a lot around behaviour change and potentially providing cycles for people and training, but we also need to make sure that the environment is more conducive to people being active travellers. So there's lots of work ongoing and bids being developed to have more cycle routes and to try and test different ways of encouraging people to get around. And even though we're a rural area, so this will always be, the car will always be important. If you look at our short distances, up to 3 kilometres, we still don't walk or cycle those either. So there's still room for improvement there. So the final thing we looked at was indicators. We wanted to have indicators where we could benchmark ourselves against other geographical areas, where we could potentially look below the Northumberland level at the inequalities within Northumberland. And it is quite challenging finding some of these using the national indicators, but we feel like there's probably a little bit more work needed on the transport indicators, which we'll continue to do. But for the housing and inclusive economy, these are the indicators that we're proposing going forward. So the Health and Wellbeing Board, they were happy to note all the achievements that had been made since the first strategy was developed. And we're happy to the change in name and priorities. So yeah, any further discussion from today, we can also take forward into the next steps, which will be, as Jill mentioned, reviewing having a sort of a revised joint health and wellbeing strategy.
Thanks.
That was it.
Okay, if I can just draw your attention to a few real key points here that I think are really important for us to appreciate and perhaps talk about. When we started off this work stream, we pulled together the issues like of fuel poverty, etc., which were things that we could start working on very quickly and hopefully make a difference. This work stream, though, is really about some real fundamental issues and some long-term factors we need to address, because you've probably heard me say this before, but the most spatially clear expressions of the most clear patterns of inequality are those to do with health inequality. They're the ones we can see different things playing out in different parts of the county. So clearly, there's something going on about where people live and how people live. And that's why, when you go back and you talk about roles, about places like planning, disciplines like planning started off being part of public health because it was to tackle the problems of the inner cities, cholera, etc., things like that. So there's been a long-term understanding of the relationship of places and the causes of health. But there are some really fundamental issues here, okay? And one of them that we keep mentioning is one of the best things you can do for somebody's health is often get them into work, okay? And endemic poor health is a cause of low economic activity rates, and low economic activity rates are a cause of poor health. So breaking this cycle is really, really important, because when we talk about health inequality, I think we all tend to think, particularly when you talk to the public about this, it's about inequality in terms of access to healthcare facilities. It's not. Because some of our more disadvantaged communities do have good access to healthcare facilities, but that is treating the problem once it has occurred, okay? So what this new, like stage 2 of this work on a place-based approach to health, I think will be about making the hard decisions now, because we can write strategies and refresh strategies all the time. It's when we start making the hard decisions. And what we've got to be able to do with the evidence, and that's why evidence is important, is place more weight on this in when we make decisions. And it's very easy for us to all sit here collectively and say, yes, in the abstract, we absolutely agree with that. I want to be thinking more about health in decisions. But they will come, and we'll be talking about how we're going to include more health impact assessment in planning recommendations, that we need to place weight on this. And if we're saying if this project, if this scheme isn't going to have a positive contribution to tackling health inequality, we should say no to it. And without straying into other areas, this will also take us very much into the territory of things like gambling shops. Maybe. Things which demonstrably have a negative impact, but the public sector generally are sometimes held back from making those hard decisions. And this entire presentation really is a call to arms saying that we've got the evidence, it's important, we've done the initial work, so phase 1 is over, and this is about putting this really into practice and starting to hopefully make a real decision. But with that, making a big difference will require hard decisions. And there will be challenges to us all. Because when we talk about personal responsibility, when we talk about places, we're also talking about people's, freedom in some respect here. And there'll be an argument saying that we are intruding on some elements of decisions here. But the evidence is unequivocal on this. And that's why I start off by saying, when you look at health inequality, it plays out in different places. So there's clearly things going on which contribute to that. And it isn't just one variable. Okay.
Right, are we ready for member questions? I can just see you, Councillor Bowman.
Thank you for the report. It is really hard reading, and it goes straight to the heart, doesn't it? The background, as you point out in section 5, is related to jobs, housing, education and public transport. Can I just highlight a couple of those? The first one being jobs. It was not that long ago they were going to have a mega factory at Camas. That's no longer coming. Jobs don't seem to be on the horizon, as it were. We need to go to a greener economy for jobs, green industries and so forth. We should be looking to the future. But when I read the paragraphs that you've highlighted in this report about employment, I don't see those paragraphs indicating anything of a vision for the future. It talks about working with other partnerships, other organisations, but I don't see Northumberland County Council actually getting up off its hind legs and doing something and really trying to bring in good quality jobs, well paid, and jobs for the future. We need thousands of jobs. You've indicated that there is vacancies remaining in social care. And the reason why there's vacancies in social care, it doesn't take much of imagination to work that one out, is because of low pay. People aren't going to go out to work for low pay. They're going to go out to work for a decent job that's highly paid and secure. And that is the future we should be looking to in the future. Green, good quality, and future-proof. I don't see that in this report. And when it comes to housing, you've got quite a lot of extensive reports on about housing, how you're going to improve it. A lot of housing in Northumberland are very poor, and damp and cold and very expensive to heat. And yes, you've identified that. But a lot of social houses are actually damp as well. Damp and cold, beyond their days, as it were. I don't see anything in this report about building new homes, social houses, for the future either. And then we want to...
your point is...
Sorry,
come on,
Chair, I just want to
I know, I want the point.
conclude. I just want to conclude. And the reason why I want to conclude is I can see what you've done. I can understand why you've done it. I can see why you've written the report the way you have. But the realities out there are somewhat not in sync with what I see. What I want to see in this report is the answers to the future. I know what the problems are. I get them every day in phone calls, emails. I want the answers in this report that's going to build a better life, a healthier life for the residents of Northumberland.
I've got Audrey at the back wants to come in on this. Or is it Jill?
It'll be me first, if that's okay. I'll hand to Audrey. Just to remind all that this is for the Health and Wellbeing Board, so not totality of ownership in relation to economic and regeneration for residents or for the county council. Underneath the overarching banner that we're going to develop of the county partnership, there will be an economic partnership that will drill down into a lot more detail. That said, there is an opportunity, and you're absolutely right, to bring more employability data from a health perspective into the joint health and wellbeing strategy. So I just want to highlight that the Health and Wellbeing Board is only a part to play in the overarching partnerships, so can't have a full responsibility. I'll just hand over to Audrey.
Thank you, Jill. Thank you, Chair. And actually, members of the Facts Committee will be aware of this, but just to remind everyone that as part of the education, send and skills portfolio, we do have a skills team, and Rob's absolutely right. The connectivity between employment poverty is about skills training and ultimately into employment. We have an extremely successful skills team who are actually focused in a number of areas around the whole of the county, north, south, east and west. But they run I'm going to use Blythe in the southeast because we have a fantastic facility there where every week employers come and people walk away with jobs. That is reported on a routine basis. So I think actually what has been highlighted is we must make sure that we join up the employability and the skills data, particularly with the strategic aspect, because that's not yet sufficiently joined. But to give members some assurance, and Facts members, of course, will have heard this through the annual report and through a number of different approaches. You will also get to hear some development around Energy Central Learning Hub and the skills training that will come through there, particularly around green jobs. And Northumberland Skills will be a part of that in delivering skills, green skills training for young people in Northumberland. And we are currently recruiting to that for a September new academic year start. So there will be more to come about that. That's a teaser for the future, but our Facts Committee members will be familiar with that. Thank you.
Very quickly, just add to what the last two people just said and say something really clearly here. Yes, we have an economic strategy which focuses on good quality green jobs tied to the growing new sectors in the economy. What this work is saying is that we are doing that, and we need to make sure that we are aware from a skills basis that the people who are currently economically inactive because of things like health reasons have access to those jobs. So this piece of work can't do everything, but it's putting the flag up saying that we need to regard it as being really significant to making sure that when there are new opportunities, those opportunities don't bypass the people who are actually at the most need from them. In the same way, this year we'll also be developing a new housing strategy, and in that will be a lot about expanding our stock of affordable homes, which we all keep talking about, but at the same time making sure that our existing stock, particularly of social homes, are fit for the 21st century. So we may have to temper expansion of numbers versus upping the quality of our existing stock or replacement of them. And that's why in here, it's really important that there are two good worked examples, and the really significant one is of the Hurst, because that's an area that will benefit not through expanding the numbers there, but through improving the quality of what is there. Okay.
Councillor Ball.
Thank you, Chair. So one comment I have with regards to the report is some of the language used, and it's national standard stuff. So your stable and appropriate accommodation, and affordable homes. For me, what is an appropriate and stable home? It might be a tick in a box of being appropriate, but actually if it's got mould on the walls, if your windows are rattling every time the wind blows, actually is that a good place to be able to bring up your children and give them the best start to life that we've just been talking about? So yes, there may be the national standard of what is a stable and appropriate home, but is it actually a stable and an appropriate home? Is it the best place? And should we not as a council be really pushing for them standards to be raised from private landlords, the social landlords, and including ourselves and raising that bar. Because when you look at things like, when you hear the words fuel poverty, you automatically think that people can't afford to put the heating on. Not that energy efficient rating's not above D. Because the thing is, you can put somebody in a home that is the most energy efficient, it's been retrofitted to an inch of its life. But if you can't afford to put the gas on when your child's got asthma or breathing difficulties, or you've got COPD, it doesn't matter how great your house is insulated. So I think it's them standards, and I think as Northumberland, yes, we have to dance to the tune of the national standards, but we need to be putting pressure on and lobbying for them national standards to be raised as well. So I'm just wondering if there's any place for that, and then for us to turn around as Northumberland and go, this is our acceptable standard for planning, for housing, for education, for youth work and everything else. Because to be fair, that's what we're here for, to raise the bar for people of Northumberland. And I just think, yes, appropriate accommodation, but actually would any of us want to live in a house that's blown a hoolie on a Tuesday in December? We just wouldn't. Thank you.
We once had a report from somebody who said if we wanted to upgrade, I'm going back 10 or 15 years, upgrade Northumberland houses with, you know, modern and efficient, it would take 500 years because we've got that many older properties. Now, where do you start with that? Because you're talking about knocking down and rebuilding, but I don't think we can do that because they're not all ours. But I do like to have positivity, not negativity. We do build some wonderful, affordable houses that are well heated, well insulated. They're not all the doom and gloom that people are painting. They are good houses, better than some of the standards that's being put up from national builders. Anyway, I'll move on. Kath.
Yeah, it's just basically part of what Caroline said. We can do great with social housing, which is bringing it up to decent home standards, that's fine. But then you've got the private landlord whose properties are just falling apart. And we're talking about health and, you know, well-being here. And it all starts off in a house, so it's your upbringing. And my concern is that about private landlords. How do we bring them in line to what we're trying to do? Because it's a big task for us to do now. And I think that's the starting point. I know the selective licence is coming in my area, which is great. But we need to get on top of private landlords as well. I mean, I'll just, one instance, a family living in a house with hardly any windows in, but they're living there. You know, and that is what we're up against all the time. So there's that inequalities there, or, you know, and it keeps coming up about inequalities, and I get a bit knocked about it because I'm thinking, well, we need to do something more than what we're doing. So, and I do appreciate social housing, especially council. They are bringing them up to decent home standards, most of them. But, so, I mean, I do agree with that. But it's the private landlords. How do we get them on board? You've got a lot of absent landlords, live down south, some live in Hong Kong. How do we get to the grips of that? You know, that's the sort of thing I would be wanting to look at. Thank you.
Right, who have I got on the list? Councillor Hill.
Thank you. Just to follow on from what's been said and what Caroline and Suzanne were saying, there's some good stuff in this and a good putting some flesh on the bones. I would just like to see us thinking big and being radical. And to that end, there's 3 points I'd like to raise. And it comes to actually challenging the government on their skewed priorities. So first of all, you know, changes to planning and so on. It all seems to be about making it even easier for developers to drip feed the market and cherry pick the best land. Rather, we need a radical social housing build. I know this can be fed in for the housing strategy. Second of all, on transport, I mean, I see this a bit here about Berwick and its cargo bike, which is, you know, I'm all for small things. Small things add up to big things. So not knocking that, but it's hardly transformational. And the government got such a skewed priority on transport. When you talk about rail, for example, what people want with rail, they want connectivity, punctuality, cleanliness, affordability. They don't think, oh, I want to be able to get to London to Edinburgh 5-10 minutes. You know, and that seems to be prioritised to the exclusion of everything else, including reduced services up here to make way for shaving a bit of time off the journey time. That is not the priority. You know, and we can all work on the train and so on. That's not the priority. And finally, on the sort of thinking radically, there's a trial for universal basic income happening in a couple of places in the country, started last year, and it'll be a 2-year programme. It's a really interesting concept, and it would really radically tackle inequality. And there's 2 ways you could do it: guarantee everyone a basic income, where everyone has this basic income. They're all very interesting ideas, need to be trialled and examined, and I hope we watch that closely, and I hope we put ourselves in a position for further pilots.
It also involves councils having to vote uncomfortably for plans to go through.
Chair, can I just add one thing to this? I think some really good points have been made here. I've got 2 things to say in reverse order. I think it's really important about energy efficiency. I hear what you're saying about fuel poverty, but when we talk about affordable housing, we shouldn't just think of being affordable to getting your front door key. It should be affordable to live in. And highly energy efficient properties are cheaper to run. Okay, so we should be place as much emphasis on quality in terms of, you know, the home to be in once you've got your front door keys. In terms of making the hard decisions, the bit of work we've just kicked off as well, and we'll be talking to the parish and town councils in the neighbourhood plan areas and to all members about this, is we can demonstrably meet our housing target in terms of coarse grain numbers from government. We are unusual in that, because lots of places are getting hammered by the government for not meeting their housing targets. We are meeting the numbers and exceeding them. That gives us the ability, and we're going to be introducing a thing called design codes. And design codes are meant to be an instrument where we can actually put out there in black and white what we expect the quality of new built housing to be. Because otherwise, when we're talking about good quality, we've all got probably got different ideas of what good quality will be. And some people will be thinking about aesthetics, other people will be thinking about thermal efficiency, other people will be thinking about adaptability for people with mobility problems. So the design codes will be an opportunity for us to agree a common statement of what we want in communities. And then we will need to test ourselves by saying we will regard those as important. And if schemes come forward from developers that do not meet that, we need to say no to them. And that's the challenge to us collectively in this room. Okay.
Right, I've got Councillor... no, Mr Hodgson first. I've got on my list, and then Suzanne, then Isabel.
You know, let's cut to the chase. If you talk about priorities out of all this, you've got to put education number 1, right? I mean, this is just my view. And I'll just give you a little bit of background. In the 80s and 90s, I worked for many years in Notting Hill before it became gentrified, before Hugh Grant and the film, right? And,
who's Hugh Grant?
And I worked a lot with ethnic minorities, a lot of immigrants, and they lived in housing conditions with private landlords that you just could not imagine. And I mean that. So everything you describe as poor housing, they had it times 10. But those families saw education as the key. Second generation, those kids have gone to university, they've got successful jobs, not every one of them, but a significant proportion. And those families, that second generation, are not living in poverty. They're not living in the basement flat of a Victorian house in the poorest part of Notting Hill as their parents did. And that's the key to it. We can put and talk about all the other social problems, but if we can focus on education, we can provide the next generation with the key to getting out of poverty. To have the skills, to have those jobs that you talk about, and that will be, well, to me, the step up for these issues.
Chair, can I just respond to that? I mean, I agree with you about the fundamental importance of education, but I have to disagree that we have to be tolerant as a society of poor quality housing.
Never at any point did I say that. What I said was I gave an illustration of a generation that lived like that, that is very comparable with the conditions that people, this generation, is also living in.
Yeah,
I never at any point did I say an acceptance of it.
Yeah, no. From my perspective, the risk is that we often hear it, and I use this as an example when I did a presentation on housing before Christmas to members, that in the 1960s it was hard to buy a house, but you didn't go on holiday and you made do, okay? The affordability gap and pushing people into rented accommodation is more pronounced now than it has been in the past. And tackling the good start in life, which we've been talking about, I agree, education is fundamental to that. But as a platform to make best use of that, good quality housing has to go hand in hand with that. And I would not disagree with you that education is important, but good housing, fit for purpose, should be an absolute building block. That's what we called it this as part of this. Because without that, when you look at, like we mentioned, one person mentioned about parental responsibility. And time and again, what the evidence shows us is that if we do not have robust communities for people to live in, and housing is a part of that, that just almost dissuades people from taking longer term decisions, say, on the value of education, because they are faced with such problems of immediacy, which means that it becomes a luxury for some people to think about education when you are faced with some of the day-to-day problems we've seen. Because what we're seeing as well, remember, at the moment, is we are seeing people going on our home finder system who are currently in private rented accommodation, and we have seen the single biggest increase in people going on what used to be called the council house list in the last 12 months, as we have in the last 15 years or so. So all these issues of affordability, fuel poverty, and the quality of homes are all playing into each other as well. And some private landlords are wanting people out of the homes so they can sell them or use them as holiday lets in some parts of the county. So it is almost a perfect storm in housing. I mean, I hate to be negative about this, but it is something we really need to, it's a nettle we need to grasp at the moment.
Right. Will you come in?
Yeah, just it's probably again back to how we've separated the themes out, but the reassurance is that education is in the children and young people's theme, because otherwise I think we would have had this theme as the biggest one. So I think there's possibly a way we could illustrate that in the revised joint health and wellbeing strategy. So people think, oh, well, education's missed. It's not. It's just the partners and the partnerships and the action plans that support that are sort of around the partnership that you heard about in the item just before. So it's definitely, I agree, it's one of the biggest priorities, but it's just not in this bit of other joint health and wellbeing strategy.
Right, Suzanne Aiken-Fellis.
Oh, wrong way around, Phyllis Aitken, but it's all right.
Sorry, Aiken-Fellis, Suzanne.
Thank you. I agree with Alan that it is about sort of education and starting young. So I welcome the focus on the safer routes to schools. And although we've got a cycle route going in at the moment, it's still precarious getting across town for a lot of our children when the school has been moved. My interest early on in the Facts Committee was sitting on the school streets, and I've heard nothing more about it. I'm thrilled that 7 school street schemes have gone ahead. I'd like to know about sort of the results of that. Has there been, are you going to roll it out further first of all? And in the results, is there has there been a benefit, a net gain in kids walking to school? Is there cleaner air around the school? I mean, has all that kind of been taken into account. I'd like to see the results of that because I'd like to see it rolled out further if it does work.
We
I know it's controversial.
we might not get that answer for you today, but...
All right, yeah, it's a details thing, I know.
Okay. Isabel Hunter.
Thank you, Chair. Thank you for the report. And I think we all need to continue to promote communities together, because people are going into poverty now that have never needed to in the past and never known where to get help. So I think, first of all, that's the thing that we all need to continue to do. Housing, we need to make sure that the right type of housing is in the right places. And I think, as Rob's saying, we're meeting the target. So now it's how planning officers can advise us as members as to how you can approve or reject a planning application because it doesn't fit that area, because it could be size and connectivity in that. And broadband as well. We need that full fibre broadband to as many properties as we can to allow people to work from home so many days a week instead of them having to commute. Plus, that could help the economy, help the jobs, because they could promote the jobs locally, but also for education, because children need that. And also we need to look at cross-border transport, because in the north, it's not just transport in Northumberland. We need to look at the Scottish borders as to where we link. Thank you.
Okay, Councillor Hardy.
It's just picking up on the housing issue and the skills issue.
Microphone.
Sorry, just picking up on what has been said about housing needs and creation of jobs and skills issues. I live in a house that was built for working men to live in, and I took it on from a social landlord who could not afford to repair it. It's damp, it's cold, and it's last century's house. And my biggest problem is getting tradesmen. We can all talk about nice factories coming in, employing millions of people, but if we don't have the people with a skill set, try and get a painter, try and get a plasterer, try and get an electrician, try and get a plumber, try and get the basics. And it's taken me well over a year to get my house into a habitable form. The other part of the problem that we have is people don't want you to change things in a conservation area to make your house better to live in, more affordable to heat, or to have windows that actually retain heat. We need to stop trying to square the circle and go back to basics and get our children into apprenticeships and our people doing the jobs that we need them to do to have the social comforts that we desire.
I think it's a fair point about tradesmen, especially in the rural areas. You just can't get them.
Just add one thing to that. I think that's a really well-made point, because, yes, there's a shortage of skilled trades, and there's a particular shortage, and this is a national issue picked up by Historic England, that there's a particular shortage of people who can do work on historic buildings, because that requires a particular skill set and a knowledge of materials and products, and that's a real limitation at the moment.
The other thing is, I'm a private landlord because the farm I've got in Scotland, yeah, you all hear it, yeah. We do everything bad. It just seems a never-ending train of spending money on these properties, and you don't get them back in the way that you leave, you sent them out, as it were. And I lived in a farmhouse at Great Whittington that was built by Napoleonic prisoners of war with stones from the Roman wall. So I've probably ticked all the boxes there of being horrible. So, you know, and if you heat your house in the rural area with oil, you pay for it all up front, not monthly, all up front. And if the price of oil's high when your tank's empty, you've got Hobson's choice. So it's not all plain sailing. Right, Mark Swinburne. Sorry.
Thank you, Chair. Councillor Hardy's actually just sort of jumped the gun on what I was going to say some of. It's with regards to housing. So back in 67, 69, which I know one or two of you might remember, they introduced a standard called Parker Morris standards into housing, which some years later was subsequently removed, although in the early 2000s they did bring back some building standards, and it related to the sizes of rooms, but Parker Morris was also about how rooms were heated to make sure it was, you know, sufficient heating and ventilation around properties. And it makes us think that do we have a standard? And it's been brought up already about standards. Do we or can we have a standard for at least our social housing properties? And when I say this, I'm going to relate it to some of the repairs that need to be done, because I do get complaints of some of my residents that question the standard of repairs. And I'm going to relate this to something else Councillor Hardy said, and that is trades. And this leads into education and apprenticeships. And many years ago, I used to have my own property improvement business. And as you said, Chair, when you rent properties out, you don't get them back in that condition. And I used to, you know, do kitchens, bathrooms for a fraction of what people might pay for their own property, for a simple reason that in 2 years' time, it was, you know, for landlords, because in a couple of years' time, it was going to be wrecked. So you weren't paying £10,000 for a kitchen. You know, used to do it for a fraction of that. However, if we're doing repairs for our tenants, they need to be done properly. And I think we're missing the old clerk of works that we don't seem to have nowadays, that check on some of this. But do we have a standard to make sure that things are done properly? That's the first point. Connectivity. Councillor Hill has mentioned about the trains, and we all know that Berwick has been named as having the most visits on railway stations. No doubt if Councillor Hill wasn't coming to meetings, it would go down by half. I'm sure it would. And it's great. But as she mentions, you know, knocking 10 minutes off, you know, Edinburgh to London, is that really important? Because I know in our town, in Cramlington, we can't get extra services in Cramlington because they're too focused on knocking 10 minutes off that Edinburgh to London. So, you know, we're not on the new Northumberland line. So all we get is, you know, that visit to Newcastle once an hour, and it only starts at 8 o'clock in the morning. And that's all we can have. We can't have anything more, and we've lobbied for more, but the priority is that Edinburgh to London line, so our connectivity is either that or we get the bus. And I've got to be honest, the bus services, the reliability is an absolutely shocking state. You either get, and it's an old adage, you either get 3 or 4 all at once, or you get nothing, or the sale pass saying, no, we're full, because you haven't had a bus for an hour, hour and a half, something like that. Moving on to the cycleways, and Councillor Daly's got a big grin on his face, because this is our bugbear. You say that, you know, the big thing that you want to tackle is the 3 to 5 kilometres. Cramlington has the most extensive cycleway in Northumberland and only one of 2 in the whole of the country. And it would be ideal if you could promote what we've got in Cramlington. We've never seen it happen yet. In all the time I've been elected, and I'm sure, you know, the longer time that Councillor Daly's been elected, if we could look at doing something there, we've got the ideal setup in Cramlington. A loan bike scheme could benefit, you know, those who may not be able to manage, you know, those underprivileged people who may not be able to manage to get a bike themselves. The health benefits that could do, the fact that it tackles those who, you know, couldn't manage to get theirs, the health benefits. We've heard that child obesity is massively on the increase, so we can look at that. There's also tackling the improvements in congestion and pollution around the town, and Cramlington is just at the top of that list for being able to tackle it. And yes, we need some improvements in what we've already got in Cramlington, in those cycleways. They were built, 60s, early 70s, and we've had little investment in it since. But I'm just asking, please, if you're going to do something, on that connectivity, on the cycleways, we've got a showcase there, just waiting and begging for something to be done. But
I live in Cramlington, and I'm always using the maps that you put in of the walking and cycling routes. But it's just when you try and leave Cramlington, it's not always as well connected as it to other parts of towns. But actually, within Cramlington's a great place.
I'm going to allow Councillor Daly to chip in on this. Be quick because
I will be quick because I know some people have spoken about the new cycleways that they're getting. It's wonderful. They're not going to be looked after and maintained. You're going to end up with a nice cycleway that, like we have in Cramlington, where there's a lot of work needs to be done. And actually, I think the point that Councillor Swinburne makes is a bit of investment on our current infrastructure will have immeasurable impact, particularly on those shorter journeys. There was a couple of things that I just wanted to flag up if I can. Rob, you mentioned about some building standards that we're looking to develop. There are lots of elements of control that we have as a local authority, particularly on public health, with new takeaways being rejected because of their proximity to schools. I think we need to have a relook at that to see what additional powers we can have, because I think it's pretty much a given fact that the majority of the takeaways, the really fast foods, are in some of those areas with the more challenging health issues. So we need to have a look at that, particularly in proximity to schools. I'm delighted if we are going to look at housing standards, because this is a fact, and I checked it before I said it. I just wanted to confirm it's right. A house built in Sweden is 3 times more energy efficient than a house built in this country. And if we as a planning authority can say to Bellway, Persimmon, and whoever else the house builders want to put in applications here, you can, if you want to build and all the boxes are ticked, you can build. But you know what? These are the standards. This is what we want you to do. We want money up front. We want our highways infrastructure, our cycleway infrastructure, and we want houses which are future-proofed to ensure that the energy efficient matches those of our European partners. And Sweden is an exemplar. And seriously, have a look at Swedish house building. I think that is really important. And on the final point, which Councillor Bowman, you mentioned about skills and trades, and other people have as well, and Colin, you did. Northumberland Skills has done a huge amount of work on promoting trades and skills. A long time ago, when I was deputy leader, Dean Jackson and I went to the Port of Blythe to discover this very derelict building, which was apparently, quote, a welding centre, which was never used. And that's when the point started and discussion started about creating that welding centre, which is now in Blythe. And that's part of a bigger strategic look at how we can encourage both, yes, those who want to move down the academic route of university, but also to absolutely ensure that those skills which you've mentioned of those challenges are met, and that people see a positive way of becoming a skilled tradesperson. And quite frankly, if I was going to be reborn, I'd either be reborn as a parking meter in Newcastle, or I'd want to come back as a tradesperson, because the amount of money that you can make as a plumber, a builder, a decorator, you name it, you can pretty much command your future. And I think this is something we need to get out into our schools, is the link between learning and earning. And that's where I think we've got a golden opportunity here to talk about those links. So I think there are some radical things we do, but let's please have a look at existing powers and how we can strengthen them, particularly around public health and housing.
Just to be clear, there are 2 opportunities for this.
Clock. We've got another item to come, so let's
very quickly. We're talking about building standards here, and so we're talking about 2 separate lines of work here. There's the maintenance standards, and there's the design standards. So the maintenance approach And how we propose to do that will be in the new housing strategy, because that needs to reflect a thing called the new Social Housing Regulation Act, which just came out a few months ago. So it's timely to do that, and that gives us the argument to have high standards. And then, in the same way, through national government changes, we're also going to work on design guides, which will look at the design quality of a new build. So both those, both the maintenance and what we're building new, we can, well, it is a political and a stakeholder debate to how far we want to push these standards. And are we prepared to take a firm line on this?
Right, we've had a relatively been all over the county on this one today. I'm going to ask the portfolio holder for whatever we've talked about to come in. Councillor Veronica Jones. And then we'll wrap up and then get on with the final one.
Thank you very much. I didn't want to speak at the beginning because I didn't want to sort of say things that were then later in the presentation. But I do want to sort of say something now, but everything I wanted to say has been mentioned somewhere by either the presentation, the questions or the answers. So I've just wanted to pick out a few things. So this report is the final one of the 4 themes of the Health and Wellbeing Board strategy. It's the one I find most exciting because it is about all the things that are our daily living, the building blocks. And that's why it's a good name change to make it the building blocks. And there's a reason why you mentioned the cabinet. It does actually cut across every single portfolio. But, you know, you mentioned education. It's not sort of housing or education or jobs or education. It's all of those building blocks and education. It's just education comes into one of the other themes. But they all knit together. And because we're seeing them individually, the whole thing does come together. And I think our record on education in Northumberland is quite good. I think we've got all the new schools, we've either got new buildings or improved buildings or school buildings in the process. And Audrey will correct me if I'm wrong here, I think it's 94% of schools are rated good or outstanding. So we've done our bit there. For now, we'll go better. Yeah. Well, the outcomes comes to everything else we do.
Sum up.
Right. So, but the whole...
I'm the chair.
I just wanted to say about the whole strategy. So, basically, it was a 10-year plan, and I'm just going to give us a weeny bit of credit here, because it was a bit radical when we first did it for a 10-year plan, because previous Health and Wellbeing Board strategies had been more like a mission statement, you know, with a aspirational, and this one was the first one that actually identified, and I think Liz mentioned there was work done on identifying the issues, and these 4 themes with their underpinning parts were identified as what we needed to look at. So the last 5 years has been more of a look at, and we have come forward and things have been changed and actions have been, so we looked at statistics, looked at the picture, looked at what was happening on the ground. So this is now sort of the next 5 years is the let's get this right, go there. But all of them have got like an they are overarching. All of them have got things sitting below them, just on the wider determinants one we've just listened to. There's a lot on housing, it's one of the priorities, and under that, so I'm going to do a cinema thing. Coming to a Health and Wellbeing Board near you soon is the Healthy Neighbourhoods report, which is coming to the Health and Wellbeing Board this week, and there'll be others. I think was mentioned the Hurst and the Blythe work. So all of that links together, do the work on private landlords. So all of that sits below this wider determinants, and that's on housing. There's all the other blocks that come with it. And we don't sit alone either. So, you know, we work in partnerships. We work in partnerships with the voluntary sector, as well as the other parts. So sitting as well is the poverty. So there's been a lot of debate, and it's really good. You know, one of the things I'm really delighted about is the amount of debate there's been on this. But things like the poverty, there's sitting below it, and it's been mentioned, is the Poverty and Hardship Plan. There's the Inequalities Working Group, which is a cross-party governance working group that looks at every other part to make sure it's happening. And I say we've now got looking at the healthy neighbourhoods. So I think I've got down all my little things I scribbled as you were talking. But I think that the main thing I want to say is thank you for all the questions on both this and the earlier one, because it does mean that as a council we are sitting together caring about the same things. So thank you. I think I've done.
Thank you very much. I'll move on because I've got an eye on the clock. Thank you for that. Item 6, NCASP Annual Report. That is Northumberland Children Adult Safeguarding Partnership. I think, is it? Yeah. So we've got Graham again. Sorry about that. That's all right. Right. Who's going? Who's gone? Graham, the floor's yours.
Thank you. You've got me back again, but I'll get Heather, my colleague, to introduce herself as well.
Good afternoon, everyone. I'm Heather Mackenzie. I'm the Strategic and Operational Senior Manager for Adult Safeguarding.
Okay, colleagues, this is the presentation about the Safeguarding Partnership Annual Report. You've seen the annual report. It is a full and thorough document. I hope it's accessible and readable and gets the key information through. But what I'm going to do is just take a presentation through just some of the key elements. And some of that will be about process and structure, because we had made significant changes in development in our approach to safeguarding in Northumberland over the last year, covered by this report. So back in 2022, or earlier in 2022, both the Adult Safeguarding Partnership and the Children's Safeguarding Partnership had a number of meetings and decided that they wanted to integrate those safeguarding partnerships, thinking this would add value and learning and development for our approach to safeguarding. I've got to say, nationally, we're one of a minority of authorities that have integrated our partnerships. But I've got to say, I think, as I go through this, we'll show some evidence already of the positive learning, development and approaches that we have taken here in Northumberland. One of the challenges is the legal underpinning for both children and adults is different, but to reassure yourselves as elected members that actually we meet the statutory requirements of both children's through the Working Together 2018 and for adults for the Care Act 2014, the requirements on safeguarding partnerships are met. I am going to show the structure because I've got to say I've been involved in children's safeguarding for very many years, and a number of you who have been involved in FACTS and other committees will remember what we used to have as an independent chair, both of the safeguarding children and safeguarding adults, was Paula Mead, who was here, and that was the approach to independence, was to chair the big committee meetings. And I've got to say, my view is, whilst they did have some benefits, a lot of those worked well because of the work of a few individuals, and actually you'd have a lot of meetings with a lot of people attending but not necessarily actively contributing. And one of the things we've tried to do with our new structure is ensure that there is focus about each of the areas of work, and the structure is streamlined, efficient and actually engages partners in focused work. And we've actually got, I'll just run you through the structure very quickly. We have got an executive group which is senior leaders across the partnership. We've got the statutory partners for children, which is local authority, police and health. We've also obviously got the lead for adults with Neil as the DAS, but we've also got health through the trusts and CNTW as part of that executive group overseeing the strategic development and the key elements of the NCASP. And then sitting underneath that, we have got separate business and adults groups, business groups. Those are made up of chairs of the subgroups, which I'll come on to, but those make sure that we do focus sufficiently and specifically where we need to on adult work, safeguarding work, or children's safeguarding work. The chair of those two groups is the independent scrutineer, the role for which I will come on to in a minute. But then sitting below and servicing those and other partnership groups are a range of subgroups, some of which we've integrated through the process, some of which we have left separate as adults and children's, depending on the need and the focus. Now, I've got to say that that's been in place now since April of this year. One of the things that the independent scrutineer has done, which I will come to, has attended all of these groups and got feedback from partners and their engagement with it. And there's some very positive feedback about how well, to date, and it's early days, we keep evolving this, that this has worked and is engaging with people and is in focusing on key areas of business. So what does a safeguarding partnership do? One of the things it doesn't do is operationally manage work. Safeguarding partnerships do provide leadership around safeguarding, strategic direction, a range of other areas to make sure there's governance and assurance about that. They have to provide scrutiny. That's the point of a safeguarding partnership, is to provide challenge and scrutiny to ensure our work safeguarding children and safeguarding adults is as efficient and effective as possible. And that does require constructive working relationships, which does include significant challenge. I will give examples where I have been, as Director of Children's Social Care, been challenged by other agencies about some of the work we do. Equally, I will challenge colleagues about other things there. And we've got to have that as a constructive approach to that. And the partnership itself will provide that challenge and scrutiny to the work. But the other elements that the partnership has to do is develop learning to make sure we are continuously learning from and improving the quality of our safeguarding practice through a range of methods. But one of the key things that we've wanted to put in place here is the so what question. You know, how can we evidence the impact of the effectiveness and quality of our safeguarding partnership? And there's a number of ways, again, detailed there and as I go through, that we try to do that. And one of the things that we have changed and developed is the role of independent scrutiny. As I said earlier, that used to be through an independent chair of a committee. In Children's Services and pushed through the Working Together in 2018, talked about the development of an independent scrutineer. We have employed an independent scrutineer for our safeguarding partnership who does a range of approaches, and independence isn't just chairing the business groups, sits on the subgroups, provides challenge and scrutiny to the data, looks at some of the learning reviews we do. We'll make sure there are links with key elements, key strategic partners, and a range of things that she will do as part of our overall scrutiny. So there are other things that we do as a partnership to make sure we are as efficient and as effective as possible, which I've listed there. But I have to say, our approach to scrutiny, we were visited by the Department for Education, who came in summer to look at how we'd evolved and developed this role of scrutiny. And there is a caveat, we've only just put this in place. The DFE were very impressed by that and has taken our approach to scrutiny and is an example of national good practice about how we independently scrutinise our safeguarding work. So, what are the other things that we do as a safeguarding partners? Again, we've had sessions looking at what are our areas for priority. But not only have we identified those which are listed there, but equally within that, we're working and continue to develop a focus within those about where we need to focus. For example, I will take neglect as a priority. It is under children's, but neglect is a huge thing. Could cover a range of things. And where we try to agree and focus is what we will be looking at in terms of neglect. And if we think about how that links across to adult services, there's a lot of evidence and information about self-neglect for adults as well. So if I'm thinking about what can the safeguarding partnership bring to us, well, if I've got a child who's neglected, but actually one of the parents themselves self-neglects or has had adverse childhood experiences, all those kind of things, the links become very obvious. That if we think family about our approach to safeguarding and our approach to scrutiny and our approach to learning, it's going to be much richer and much more effective than if we do it in separate silos. So I think that goes across there. Again, there'll be other priorities for adults, traditional safeguarding arrangements. Well, that's work coming from children's services into adult services. Joint approaches are critical if that's going to work well and safely for children, young people as they grow up into adulthood. So those are just two examples of that, and those are the priorities that have been set by our partners in terms of what we want to focus on. And just referencing again our earlier agenda items, there's some of the cross-cutting priorities there. Impact of COVID-19, that's something we're aware of and critically affects and impacts some of the complexity of the work that we're seeing in the safeguarding world. And again, another clear priority is domestic abuse. Again, I'll take that as an example. There's obvious impacts on children if they are living in a household where there is domestic abuse, but equally what we have found, and I also chair the Domestic Abuse Local Partnership Board, that actually is an increasing awareness, knowledge of domestic abuse in older adults. And that's again an area of focus that we've developed through scrutiny of the data, understanding what's happening, and how do we develop and push our safeguarding responses to respond to that understanding. One of the key ways, and there's a lot more information in the report, is about one of the key ways of learning is from reviews, where you learn from where things have probably gone wrong. What can we take that's been good practice, but equally, how can we learn from those reviews in turn to inform workforce development to try and mitigate against anything that's gone wrong happening again in the future. And again, a range of reports and information within your reports about the case reviews that have been undertaken. In Children's Services, they've developed what's called rapid reviews, when we have an incident where we should notify Ofsted. That is a serious incident where a child has been killed or suffered serious or significant harm. We have to notify, and that's down to the care of the parents, and where there's been partnership involvement, we have to notify Ofsted of those. And where those happen, we have what's called a rapid review, which pulls together partners who are involved in that work to look at what they've done, to identify very quickly if there is any learning that is needed or could be taken at that point, as opposed to just automatically going into a lengthy individual case review that can take a long time to complete and take the learning. And actually our processes, again here from the DFE, have looked at those processes and see them as a positive. And where we do think there's learning, there is one case where we have this year undertaken a learning review we're doing internally, which is about to be published soon. And we will do that if there's significant learning, but if there's not, then we're not going to waste time doing a review where we already know what the issues are. And again, just looking at some of the summary of the themes for the reviews, I think I'll pick out a couple and maybe ask Heather to come in on those. But professional curiosity is a critical one in safeguarding work, needing to triangulate the evidence, information that you receive, and not just taking what people say, being respectful of what people say, hear that, but it does need to be triangulated and checked in terms of that. Because if people are going to harm either themselves or children or other people, then you have got to look at the range of evidence and information. And we have to keep pushing professional curiosity. And that is a real challenge in social care work, because you have to develop effective working relationships with the people with whom you're working. You have to be respectful and understanding and listen to what they say. But that point of professional curiosity is to make sure that you're always asking the question, what if, and can I evidence that? And are there other areas that I should be concerned about, given the nature of our work? One of the other bits I'll just pick up on is the impact of trauma. We've done a lot of work across the partnership about understanding the impact on individuals of traumatic experiences and adverse childhood experiences, how that influences and impacts on how people are, how they look after themselves, and equally from a child care perspective, how that impacts on their ability to provide care and support for their children. So again, whole systems approaches to and development of understanding of the importance of those approaches. In terms of children, engagement with fathers, that is something we've been pushing very hard. And again, I'll refer back to our earlier agenda items. Within the family hubs, one of the critical areas of practice is the work to push engagement with dads during pregnancy. So they are part of and worked with and engaged by family hubs at the very earliest point that we can. And that work flows through as a whole load of other work that will be shared when we talk about family hubs around how other ways in which we're engaging fathers. But that's just one example of thinking of a whole system approach to making sure that children are safeguarded. Heather, we'll ask you if there's anything else you'd want to pick up for the themes in terms of adults reviews?
Yeah, I think I'll just look back on the impact of trauma in particular. the merging of the partnership and having the shared experiences from all the partners, from both a children's perspective to an adult's perspective, has really driven the knowledge and skill set of the workforce in Northumberland. And it's quite unique. We have a multi-agency safeguarding hub sitting at the front door, which is both adults and children taking a family approach and developing pathways in particular for things like child-to-parent violence, not just focusing on the child, and then a different social worker ringing an adult, a parent up, asking the same questions. We're actually taking a family approach. And the workforce are learning in terms of what is the impact of adverse childhood experiences and how does that impact on them becoming into adulthood, and particularly with things around self-neglect, domestic abuse, financial abuse. So collaboratively, it's really bringing in an excellent workforce to be proud of in Northumberland.
Thanks, Heather. And just finally looking forward to, again, contained in your document is the areas of work we're focusing on going forward, the strategic priorities. There are also, in children's services, there's been an independent review of children's social care a couple of years ago, the national response to that, the stable homes built on love, and just before Christmas there was a publication of the government response to that on working together, which we are looking at, and we'll be evaluating what some of the work in there and how it fits with where we are at. But I've got to say, having had a look at this, some of the work and the processes we've put in place here meet what the national direction of travel is in terms of safeguarding partnership. Again, in your report also, there's a lot of work, as well as the priorities, about the business as usual, making sure we are sighted on, making sure we're looking to understand the quality of the practice around a range of safeguarding work, which I've not covered here, but that's detailed in your report, and I'm happy to take any questions on. And so from our point of view, I think we've got a very strong basis for partnership work. Safeguarding is everybody's responsibility. The only way we will safeguard children, young people and adults safely is to do this effectively in partnership between agencies and working effectively with local communities and the families and children, young people and adults themselves. As I say, there's a lot going to be changing and going forward in the future, but I think we've got a very strong basis in which to take that forward. I'm happy to take any questions. There's a lot of detail about some of the actual work in there. I'm happy to take questions on that.
Caroline was first.
So, great report. As we pushed with more of the asset-based community development model and relying on the community and voluntary sector to pick up some of the slack on different services and delivery, how are we ensuring that they're part of this? Because when we look at this leaflet here, it is a lot of the statutory bodies and not the youth club, the boxing club, the football club, that are, as you say, everybody's responsible for safeguarding, to make sure that they've got the right training and the right skills and everything else, and the know and are not afraid of the strategic bodies as well to get involved. And the other thing, just around domestic violence, it's coming back to that housing issue again. We know a number of women and gentlemen in these cases end up going back because there isn't housing available or suitable housing available to be able to take your children to. So a lot of people end up going back. So I'm just wondering how we are going to tackle that long term, because it is a massive issue. When you look at Home Finder, the list goes on for days, and it's the number of people that are graded in the top priority and are simply not getting housed. So it is our priority, but without them building blocks of everything else, we're going to struggle to be able to break some of them cycles, which then do have the knock-on effect to the children long term and what they see, and then the cost of all the services that them children are then going to end up needing during their time growing up as well. So just them two sides, please.
Okay, again, just re-emphasising what I said earlier, that whilst the NCASP is the key partnership looking at safeguarding, our approach is to look at this across the range of partnership arrangements. So, for example, the Children and Young People Strategic Partnership, which evolved and developed the priorities, a lot of the focus there will be on the earlier intervention and engagement with the voluntary sector, for example, around family hubs and the links to the young people's offer in the voluntary and community sector. And that also will be linking in with the communities together approaches. And I've got to say, what we're developing and evolving is this whole systems approach to safeguarding, of which that is a core part of everybody's business. So it isn't just about reporting to this partnership around that. And a part of this is subgroups will have engaged with voluntary and community sector, and we'll do it either on a task and fish basis if that is right, or as a standard member of those subgroups coming into the business group. So there's a range of approaches to make sure we are engaging with and continue to evolve to engage with key partners in terms of delivering safeguarding, in terms of that. And of which, just linking that, housing obviously are a key partner within the partnership work that we are undertaking. And again, if I look then particularly, again, my role, just thinking across the partnership, I chair the Domestic Abuse Local Partnership Board, again, obviously, of which housing are key elements, and there's a lot more detailed drilling into the work there and the challenge. But the point is right, though. If we come across areas where we think we should be challenging partners, then we should be able to do that. If we think that there's a shortfall in a provision or a shortfall in approach or resourcing that is leaving children, families or adults at risk, then that is where we put the challenge in mutually. And I have to say, we have worked hard in Northumberland to develop a partnership culture where we can do that without losing the relationships. You've got to have those relationships with which you can work. And I do think we've moved positively and got a positive relationship where we can have that constructive challenge. It doesn't give all the answers to the questions you're raising, I don't think, Councillor, but I think we have got the forums and the processes and the culture in place where we do address those and put the challenge in where we need to.
Right, now something positive from Les.
Yeah, thank you, Chair. I welcome this report. I can see the connectivity with adult abuse and child abuse, as it were. I can see why you've done it, and thank you very much, because if you take a domestic violence situation, normally it would be the lady of the house who's been abused, normal circumstances, but sometimes the child is abused at the same time. Now, I can see the connectivity, and I want to thank you for that, because two teams going in together, working together to bring about a resolution in that family is a great thing. Can I just ask a question about the period of time we've just gone through, which is Christmas and the New Year? My understanding is it true that domestic violence actually rockets because of the financial pressure and so on within the family home? And do you actually do a lot of marketing, putting banners up at schools and that sort of thing, with a telephone number, a helpline or whatever, for those people who are at risk to reach out, to get in touch with organisations for support in these difficult times?
Thank you. As part of the partnership, what does happen is our data informs what's happening in Northumberland. And a good example of that, you're absolutely right in relation to domestic abuse. It does increase, particularly over bank holidays, significant events. So in May last year, we've seen a significant spike of domestic abuse, but we also had several bank holidays in May last year. We had a King's coronation and we had a significant football match. But actually, we digged a bit deeper as a partnership to understand what that domestic abuse was. And what that did identify was an increase in domestic abuse in Northumberland in older people. So what the partnership did with that data was set out a task and finish group to look at how we promote awareness within Northumberland. And Safeguarding Adults Week took place in November, during which domestic abuse in older people was promoted. So we worked very closely with the Domestic Abuse Partnership so that they could raise awareness following White Ribbon Week, and subsequent kind of advertisement went out. So in answer to that, yes, we do see a significant increase in domestic abuse, particularly over the holiday periods. But equally, we dig in that data as well, and we try and understand what that domestic abuse looks like and where we need to target and raise awareness.
Councillor Swinburne.
Thank you, Chair. Mine's on a similar theme to that. So throughout the report, there's clear explanation of the process procedures in place for when a case is identified, the care support for children and adults of all ages and all sexes. But what I want to ask is about the comms, whose responsibility to identify. So if we look at neglect, harmful sexual behaviour, criminal exploitation, domestic abuse, just as examples, it's the comms, whether it's videos, whether it's leaflets or whatever, to get out there so that an individual can look and think, hang on, this isn't the norm. And they can identify that how they're being treated is wrong. So it's okay that we're putting stuff out there to say this is a number to get in touch and we can help and we've got all the agencies involved, but it's the initial identification that they can see that what they've been going through for the past week, 6 months, 10 years is not normal and they don't have to live with that. And there is help out there, because some people do not know that their lifestyle isn't normal and they don't have to suffer with that. So what I'm asking is, whose responsibility is it to get the information out there? Does it lie with the council? Does it lie with a particular body? Do you all work together? And who publishes that? Thank you.
I think it's everybody's responsibility, and there will be different approaches to comms across. So, for example, from the police, most certainly in terms of a range of domestic abuse, we have got and we have put out a range of posters and information across the piece, including in schools, around domestic abuse. As Heather said, there was the 16 days of white ribbon activity very recently in terms of a range of ways of trying to develop awareness and understanding around domestic abuse. But I do think one of the key elements that we have developed, and if I talk about the importance of links with the community, that actually if you are in the circumstances which are controlling or coercive, actually going to a service somewhere is quite a hard thing to do. And it's actually trying to develop the understanding and somewhere where you can go very locally, where you can kind of just ask somebody very locally, what can I do, what's happening to me? And they can then maybe signpost to it. And I think that's part of the continuing development around those approaches. We've got a range of services in place at higher levels, but I think it's the ongoing work around developing understanding of and responses to at a very local level to make sure to deal with exactly the circumstances you're talking with, Councillor, about somebody who may not be sure. They're much more likely to go to the corner shop or to their local hairdresser or to their local somebody where they might get an answer opposed to a service. So part of the comms is about trying to develop a community understanding to an approach to that. And then if you do need services at higher levels and thresholds, that can follow afterwards.
Councillor Hill.
Chair, can I just come back?
Yeah,
Is there any information, any comms that can be shared, that as members we can share out, publicly on various social media, etc., that, can help and can be published?
I'll share information with you, Councillor.
Great, thank you.
Yeah, thank you.
Councillor Hill.
Thank you. This is an excellent report, and it's obviously a critical area and an area that we do very well at and continuing to look to improve. Just a slightly different point, but it is linked, obviously, because it's all about needs of children and that putting it as a cliche, but, getting them ready for the world. A lot of comments that I have when I speak to head teachers and people involved in education is one area of concern is teaching children resilience. Often they say, we compare, sort of my time at school and going back, we're much more switched on about the soft stuff and about sort of anti-bullying and safety, all sorts of, if we look back at the way we used to play compared to now and so on. But the flip side of that is, they said sometimes, they get children who complain about this, somebody wasn't very nice and this happened and that. And sometimes it's almost like, life isn't great. Everywhere you'll go in life, you'll have people that annoy you and frustrate you and so on. So I think this is just an area, it's all very good, this stuff and everything, great, but teaching children to be resilient and so they're ready for the world.
Yes.
What about
I think so, but I think it's right though that there are a range of ways. And again, if I'm talking across the partnership, you know, we're talking about a domestic abuse, for example, at perhaps the sharper, heavier end, for want of a better phrase. But if you go back, we've got an approach to about parental conflict and healthy relationships, which is about earlier interventions, which is about arguing, not necessarily to the point of being abusive, but equally as unhealthy. And we've got a range of approaches, again, through the family hubs there, about supporting parents to work with that. But equally, and if we're talking about the schools, the range of strategies and support given to schools to develop children and young people's understanding of healthy relationships and what is and isn't acceptable. But you're absolutely right, Councillor, you know, part of this would be wanting to develop resilience in all of our children and young people to deal with what's going to be thrown at them through life. It's got to be part of that as well, absolutely.
Yeah, Mr. Hodgson.
Hi, Graham. It's just about Operation Endeavour. When police notify the schools when child concern notifications regard children going missing. Now, at the end there, you've got Operation Endeavour during this year has increased significantly by 66% and is indicative of the ongoing impact of COVID. 66% of what number? Because obviously 6% of 4 isn't a massive, but 66% of 100, and you're talking about a lot of children. So what sort of scale are we looking at here?
Yes, I'll probably have to check the detail to come back with you.
Because
it's a fair point, but I think probably the broader purpose of that, make sure, you know, if something has upset or there are issues impacting on a child or young person when they do go missing, actually the first point of contact when they come back is really important, and part of that, a lot of the time that may be at school, so they can then talk and check in with the child. But what we do have are very robust processes, more widely than that, when a child or young person has been missing for some time and returns. Within the council, we've got a process whereby we offer an independent person who goes to see that child or young person, somebody independent they can talk to if there is something of concern to them that they might not be able to talk to with people whom they already know. And we do that. But I will check the data just for that.
I mean, it sounds quite alarming, isn't it, go missing. I mean, are we talking about timescales on this? I mean, is there a definition of gone missing for 3 days or a week, 10 days? I mean...
Yeah, there's not a detailed definition of time, and a lot of it will be depending on circumstances and what we do know about the child or young person or their circumstances. So, and it will only go to the police if certain, for example, certain risk issues, that would mean they were missing. But if they are missing for a length of time, not knowing where they are, then those are one of the circumstances we would look at in terms of making sure they're safe.
Because this is not the schools notifying. The schools aren't.
No.
It's the police notifying the schools.
schools.
That's what I'm saying. So
that's one of just making sure that we are covering all approaches to children who may be at risk or who may be vulnerable. And the school, a lot of the time, is the safe place for children to go. And the point of that operation is to make sure the schools are notified very early, so they can talk to the child if the child is there, as opposed to it necessarily being somebody from a different agency.
So the child might well be at school, although by definition they're missing.
If they have been missing and then come to the school will know about that and then be able to talk to them to understand if and what the elements of risk may be.
When I read that, I assumed it was missing, and that included not attending school.
Well, it can do, and it's just making sure that if they do come to school, that the school know about this in a timely way, so they can support, work with, and understand if and what risks there are to the child.
Okay, thanks.
I will come back with the data.
Thanks.
Right. I have no... Les, second time.
Just to follow on from that, I want to just comment about Councillor Hill's remark about the resilience of school children. I did a wise thing when I was at school. I became friends with the bully, so I was all right for the rest of my life at school. But anyway, that's just a way of safeguarding yourself. What I want to ask is, have children themselves got the means of and the places to go to and the people to go to actually flag up something's wrong, whether at home or in the street, or whether in the extended family, or whatever the situation may be? Do children have those information points, as it were? Are they being encouraged at the school by giving those points, as it were? Not just the school teacher, not just the pastoral teacher, but other places to go to?
Well, most certainly. I mean, certainly in schools and other establishments, you know, where we'd have links with, would be part of the partnership arrangements. Absolutely would be doing that. But again, part of the work is about developing the awareness across the piece about safeguarding. And if somebody comes and talks to you, you know what to do about it, or you know where to go with it. And certainly we keep evolving and develop that, whether that's for adults or for children. Where could people go to hear about it? And the range of comms, just going back to Councillor Swinburne's point, is one part of that. But if we can raise understanding, awareness of more broadly across our communities, and that by definition will make them better and safer places to be, where people can go for support and advice.
Right, Councillor Hardy, we're going to run out of time if I'm not careful. So,
in my own experience, I could go off on 2 tangents here, but one, in a school in Berwick, there was an operational grooming gang, which almost claimed my daughter as one of its victims, and I spent 18 months with the police force having a monitoring station in my house to round it up, drug dealers, and there's a story behind it. The staff of the school became aware of it. They tried to do something about it. The police were aware of it. They tried to do something about it. Sometimes it's a wider picture. It ended up with a programme involving the girl that was murdered, called Paula Clennell. It was a documentary from the Berwick Academy to her death as a working girl, where they were groomed by people that thought they were boyfriends. There's a much wider aspect than having kids that are ready because these kids thought they were ready. It is having people on the ground that can recognise abnormal behaviour within what should be a safe environment. And without going into great details, you can Google the name Paula Clennell and you will see the story.
Right.
Sorry,
I think we're on a personal detail that you've given us the advice that you want to expand, but go on then.
Well, it's just one of the areas for development of the priorities is risk outside the home. And certainly in childcare, historically child protection has been about risk from family within the home. And over the last 10 or 15 years, the greater understanding of the risks outside the home and our approach and development. There is a strategic exploitation group which covers adults and children's, but equally a range of developments continue to happen about our approach, particularly in children's services, about children and young people who are at risk outside of the home. And we are in the process of implementing and developing practice policies and procedures which will sit alongside the child protection processes, but run parallel to and are more flexible and better at understanding and how to manage and mitigate risk outside of the home.
Right. I'm going to try and wrap up there. Remember that we all came from a generation that didn't have mobile phones, the internet, or that wonderful thing that we have at Ponteland called Ponteland Parents on Facebook. And I'm sure every school has something similar. Yeah, have a look. Yeah. So I think there is a challenge that none of us grew up with, which was the mobile phone and the internet. Right, we've had a longer session on all of these items this afternoon. It just shows when you have a joint meeting, your meeting goes on a lot longer than normal, but that's for by because it's been very interesting. I have got 1 or 2 items here. Report of the scrutiny officer, forward plan.
Thanks, Chair. The forward plan's just to note, there's nothing on there.
And health and wellbeing overview work programme.
The work programme, again, is just to note. I've got a big long list of things for facts and health that I'll take away.
Right. Kath wants to just push a task and finish group, what we've really opened up a can of worms on, which is the defibrillators. They're growing like mushrooms. Even saw one at our county council tip the other day.
Yeah, just that. We've got a working task finish group, which will be on the 6th of February. But we have got NIAS coming in to talk to us. So that'll be 10 o'clock on the 6th of February. So we need to wait and see what the outcome of that.
It's not 10 o'clock?
It is, isn't it?
No, that's primary care.
Primary care, sorry.
Good job, one of us is
1
away.
o'clock. Somebody's listening.
1 o'clock.
1 o'clock. So anyway, so we've got to see what comes out of that before we can move forward to where we want to be. So once NIAS has talked to about it, we can move on with the recommendations of what we need to be doing.
Right.
Okay.
I have no urgent business. Thank you for your attention. Date of our next meeting is on the 5th of March, where the nights should be a bit later. So thank you for your attendance, and I hope you found this of use.